Study with Artemis, Inc. podcast. This content was produced with the assistance of AI-generated content. Safety considerations in herbalism. Welcome to an in-depth discussion on a topic of paramount importance for anyone exploring the world of natural remedies. Safety considerations in herbalism. While herbs have been used for millennia across various cultures for their therapeutic properties and as traditional medicines, it's absolutely crucial to approach their use with a foundation of knowledge, profound respect, and unwavering caution. The allure of natural solutions can sometimes overshadow the fact that these powerful plant compounds can have significant physiological effects. Before we delve into the specifics, please take note of this vital disclaimer. The information provided in this document is strictly for educational and informational purposes only. It is not, and should never be considered, a substitute for professional medical advice, diagnosis, or treatment. It is imperative that you always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition, or before initiating any new herbal regimen or dietary supplement. Self-treating with herbs without appropriate professional guidance can pose serious health risks and lead to unintended adverse outcomes. Now, let's thoroughly explore the key safety considerations that every aspiring herbal enthusiast, practitioner, or individual considering herbal remedies should be acutely aware of. 1. Accurate identification is non-negotiable. The very first, and arguably the most critical, safety consideration in herbalism is accurate plant identification. This point cannot be overstressed. The natural world contains a vast array of plants, and unfortunately, many beneficial medicinal herbs have highly toxic lookalikes. The consequences of misidentification can be dire. For instance, the common and seemingly innocuous wild carrot, also known as Queen Anne's lace, Daucus carota, bears a striking resemblance to highly poisonous plants such as hemlock, Conia maculatum, and water hemlock, Cicuta spp. Consuming a misidentified plant can lead to severe illness, irreversible organ damage, neurological complications, or even be fatal. Therefore, a fundamental rule of thumb when wildcrafting or foraging for herbs is: never consume or prepare a plant unless you are absolutely 100% certain of its identity. This certainty should come from cross-referencing multiple reliable field guides, consulting with experienced and certified herbalists, and ideally, learning directly from a knowledgeable mentor. Always remember the critical adage, when in doubt, throw it out. It is far better to err on the side of caution than to risk your health. 2. Dosage and preparation matter significantly. The notion that natural inherently means safe in any quantity is a dangerous misconception. Dosage and preparation methods are profoundly vital in herbalism. The therapeutic potency of herbs can vary dramatically based on numerous factors, including the specific plant species, the environmental growing conditions, soil quality, sunlight, water, the precise time of harvest, which can influence active compound concentrations, and crucially, the part of the plant used, e.g., root, leaf, flower, bark, seed. Potency variation. For example, a strong concentrated decoction made from a powerful root, which involves simmering the plant material for an extended period, will deliver a much more potent effect than a mild infusion of a delicate leaf, typically prepared by steeping in hot water. Understanding these differences is key to appropriate use. Forms and concentrations. Herbs are prepared in various forms, each delivering different concentrations of active compounds. Tinctures, alcohol extracts, capsules, dried powdered herb, teas, infusions/decoctions, and concentrated extracts all have distinct potencies and absorption rates. Start low, go slow principle. A fundamental principle in herbal safety is to start low and go slow. Always begin with the lowest recommended dose for a particular herb and gradually increase it if needed, while meticulously monitoring your body's response. Pay close attention to both traditional dosages, which have been refined over centuries, and modern scientific recommendations, which often provide more precise guidelines based on chemical analysis. Documenting your dosages and any effects can be very helpful. 3. Interactions with medications and pre-existing health conditions. This area represents one of the most significant and often overlooked concerns in herbal safety. herbal interactions with pharmaceutical medications and pre-existing health conditions. Many herbs contain potent bioactive compounds that can interact with prescription drugs, potentially altering their effectiveness, either enhancing or diminishing them, or increasing the risk of adverse side effects. These interactions can be complex and unpredictable. Common examples of interactions. St. John's wort, Hypericum perforatum, is perhaps the most well-known example of an herb with significant drug interactions. It can interfere with the metabolism of numerous medications, including antidepressants, potentially leading to serotonin syndrome, oral contraceptives, reducing their effectiveness, blood thinners, increasing bleeding risk, and drugs used to prevent organ transplant rejection. Ginkgo biloba, is often used for cognitive enhancement but can increase the risk of bleeding when taken concurrently with anticoagulant medications, like warfarin, or antiplatelet drugs, like aspirin. Certain herbs can directly impact physiological systems, affecting blood pressure, e.g., licorice root, blood sugar levels, e.g., fenugreek, ginseng, or liver enzyme activity, which can alter how the body processes medications. Crucial medical advice. It is absolutely imperative that you always inform your doctor, pharmacist, or any other healthcare provider about all herbs, dietary supplements, and natural remedies you are currently taking or considering. This is especially critical before any surgical procedure or if you are on any prescribed medications. Similarly, if you have chronic health conditions such as heart disease, diabetes, hypertension, kidney issues, liver disease, or autoimmune disorders, you must consult your healthcare provider before using any herb, as it could exacerbate your condition or interfere with your treatment plan. 4. Allergies and sensitivities. Just as individuals can have allergic reactions or sensitivities to certain foods, they can also experience similar responses to herbs. These reactions can range from mild symptoms like skin rashes, itching, or digestive upset, to severe and life-threatening conditions such as anaphylaxis. Cross-reactivity awareness. It's important to be aware of potential cross-reactivity. For instance, individuals with known allergies to ragweed may also react to other plants within the Asteraceae daisy family, which includes common herbs like chamomile, Matricaria recutita, echinacea, Echinacea purpurea, and calendula, Calendula officinalis. Patch testing for topical use. If you plan to use topical herbal preparations, such as salves, creams, or poultices, it is highly recommended to perform a small patch test. Apply a tiny amount of the preparation to a discrete area of skin, e.g., the inner forearm or behind the ear, and observe for any adverse reactions over a period of 24 to 48 hours before applying it more widely. 5. Quality and sourcing are paramount. The quality and sourcing of your herbs are absolutely paramount for ensuring both safety and efficacy. The risk of contamination is a very real concern in the herbal industry. Potential contaminants. Herbs can be contaminated with a variety of harmful substances, including pesticides, from conventional farming practices, heavy metals, absorbed from contaminated soil, molds, bacteria, from improper handling or drying, or even adulterated with cheaper, less effective, or outright harmful substances by unscrupulous suppliers. Reputable suppliers are key. To mitigate these risks, always purchase herbs from reputable suppliers who can provide transparent information regarding their sourcing practices, quality control measures, and rigorous testing protocols. Look for companies that adhere to good manufacturing practices, GMP, and can provide certifications such as organic, wildcrafted, or fair trade. Ideally, choose suppliers who conduct third-party testing for purity, absence of contaminants, and potency, verified levels of active compounds. This ensures you are getting a clean, effective product. 6. Vulnerable populations require extreme caution. Certain demographic groups are particularly vulnerable to the effects of herbs and should exercise extreme caution, or in many cases, completely avoid numerous herbs without explicit, expert guidance from a qualified healthcare professional or clinical herbalist. Pregnant and breastfeeding individuals. Many herbs are contraindicated during pregnancy and lactation due to potential risks to the developing fetus or infant. Some herbs can stimulate uterine contractions, affect hormone levels, or pass into breast milk, potentially harming the baby. Infants and children. Children are significantly more sensitive to herbal compounds than adults and require much lower, meticulously calculated doses. Only a very specific range of herbs is considered safe and appropriate for pediatric use, and always under professional supervision. Elderly individuals. Older adults often have slower metabolisms, which can affect how they process and eliminate herbs, leading to prolonged effects or accumulation. They are also more likely to have multiple underlying health conditions and be on several pharmaceutical medications, significantly increasing the risk of adverse reactions and drug-herb interactions. Individuals with chronic illnesses. Those with pre-existing chronic conditions such as liver disease, kidney disease, autoimmune disorders, or compromised immune systems need specialized guidance. Herbs can impact these vital systems, potentially worsening the condition or interfering with prescribed treatments. Conclusion. In conclusion, while herbalism offers a rich and profound tradition of healing that has benefited humanity for centuries, it is unequivocally not without its risks. Approaching it with a robust foundation of knowledge, an unyielding commitment to safety, and a proactive willingness to seek professional guidance is absolutely essential for responsible and effective use. Always prioritize accurate plant identification, thoroughly understand proper dosages and preparation methods, be vigilant about potential interactions with medications and health conditions, and consistently source high-quality herbs from reputable suppliers. Your health is your most valuable asset. Empower yourself with knowledge and diligence, but always err on the side of caution. It is highly recommended to consult with a qualified healthcare professional, such as your physician, or an experienced clinical herbalist before incorporating any new herbs or herbal remedies into your wellness routine. Their expertise can help you navigate the complexities of herbal medicine safely and effectively. References. General categories of reliable sources. To further your understanding and ensure safe practices, consult the following types of reliable sources. Academic and scientific databases. Reputable sources like PubMed, for peer-reviewed scientific literature, and the National Institutes of Health, NIH, particularly the National Center for Complementary and Integrative Health, NCCIH, which provides evidence-based information on complementary health approaches. Reputable herbal organizations. Organizations such as the American Botanical Council, ABC, which is a leading independent research and education organization, and the American Herbalists Guild, AHG, a professional organization for herbal practitioners. While the Herb Research Foundation, HRF, is less active now, their archived resources can still be valuable. Authoritative textbooks and encyclopedias. Refer to comprehensive works by recognized herbalists, pharmacognosists, and researchers. Examples include texts by Michael Moore, David Hoffman, Rosemary Gladstar, and major pharmacognosy textbooks used in academic settings. University Extension Services. These services often provide localized, research-based information on plant identification, cultivation, and safety, particularly for plants native to your region. Copyright 2025.